So I want to start with Cyclospora. There's been some more investigative work on what's been, the source of this thing, but talk us through first what it is, because I think it's important to lay the groundwork here.
Yeah, I mean, cyclosporiasis, explosive diarrhea, as you said, caused by the parasite Cyclospora, generally consumed through produce, that has become contaminated. Fortunately, there's no human-to-human spread. Once you shed this, it's sort of in a cyst form. It has to incubate for a few weeks, so that's where it gets into the water supply at some farms, gets on the produce. They sit there, they germinate. If the conditions are right, all of a sudden they become the infective version of it, right? That can then get into your GI tract and wreak havoc. And that's what happened on a scale that I'm not sure we've ever seen, certainly way above, like orders of magnitude above the norm. I think in Michigan last year was pretty representative of a typical year. I think they had 50 or 60 cases. Wow. We're over 4,000 here last I checked. I haven't refreshed my browser, but 4,000 plus in Michigan, over 7,000, now over 30 states. I think 34 was the last one I heard. It sort of hit us hard early. And then, the ability to track down exactly where it was coming from, I think, was another challenge that allowed it to just spread the way it did.
Well, so how many of us have been Googling explosive diarrhea?
Yeah.
But it's a loss of appetite, weight loss, bloating, nausea, fatigue. The sort of striking thing is symptoms often start 1 week after exposure. It comes in waves, right? It comes, and it goes.
It can last weeks, last a long time, where it comes and goes. And again, for most people, this is more of a nuisance and inconvenience, now a pretty major inconvenience, like missed work, missed school, missed time, kind of living your life. But for about 10% of people now, I think the number is that have ended up being hospitalized. And majority of those are going to be people with pre-existing conditions, who's immunocompromised state, elderly people. We see elderly people getting particularly hit hard with these kind of diseases because their kidney function is a little off. And if you start getting a little too dehydrated, you can't keep up with the losses, particularly in the summer when it's hot. You end up getting worsening kidney function. I mean, it's just, it happens with other diarrheal illnesses. It's just on this scale all at once in so many places. This is what is so incredibly unique right now.
So, I think one of the things that I'm really wanted to talk to you about with this, and I think we all are sort of up to speed on all of this, is generally when something like this happens, and I'm speaking only from my own experience, I hear about the lettuce that I shouldn't eat before I hear about the disease. Right? You hear, there's a warning out on this type of lettuce or this romaine, or don't eat the zucchini or whatever it is. And then you think, well, why shouldn't I do that? And you do a little digging and it's making some people sick. This was the total opposite. We heard about this mystery illness that was sweeping the nation, and all of us sort of tensed up because of COVID again, right? I live in upstate New York, and we were planning a trip to the city, and we hear that it's sweeping through the city, and I'm like, do I want to, there's enough diarrhea in the city already. What's happening with this? The reporting is off, and is this the new normal for us?
Yeah, I mean, listen, fortunately, this is not a disease you can spread person to person, right? Cyclospora, because of that delayed period where the cyst has to become infective. And so it isn't where you can get it from somebody else. So that's certainly fortunate. Part of the problem is, there's been a lot of talk, been a lot of reporting on the Food Net program that the CDC eliminated. Again, an outbreak does happen, right? With the infrastructure fully in place, they happen. But the goal is to very early on identify the source and then get out the warnings to people in that state or across the country, whatever it needs to be, to then stop that outbreak dead in its tracks, so you don't end up spreading to 30 some states and 7,000+ people and counting. And that's where the concern is for how this has been handled thus far. MDHHS, the Michigan Department of Health and Human Services, had people working overtime, pulling people off other projects to try to stay ahead of this, and kind of did an amazing job, tracking it down and letting the public know the crisis at hand. I think the problem is the leadership above the state level. I mean, public health exists at city, county, state, and then the federal level, right? CDC, and then ultimately the Health and Human Services Department. We have a person in charge of HHS who has been reported to be not terribly interested in actually what's going on there, right? So this is the department that, like others, action can be really dangerous, right? Like actively telling people that vaccines cause certain diseases they don't.
Right.
But it's unique in all of the departments of government that it's within action, within attention, you can have crises pop up. The Division for Parasitic Diseases and Malaria was disbanded in July of 2025 under cuts for waste, fraud, and abuse, they said. And this is a specific group of people, the expertise of whom would be totally helpful in a system like this. You have people in Michigan sending out those emails or those requests for information or for help, and there's nobody there to receive them at the federal level because they just got rid of that department because it didn't seem like something, it's like screw or mitigation, then oops, look what happens. And it is the curse of public health. Public health is doing its job when you don't think about it and when you don't know about it. And when you get something in your email inbox about, hey man, maybe you want to avoid that bagged lettuce that you normally pick up at the grocery store. And you're like, oh, what's that all about? And you're like, wow, I didn't even hear people were sick. That's great. Not that many people got sick. It's just the challenge of our time and probably the new normal.
Well, I mean, that's disheartening. And I think so much of those, look, when you get a message, you get an email, you get an alert, it's in your news feed, it says avoid this. A huge part of that is the faith in that messenger.
Yeah.
Right. And so I'm wondering, and, there's a question I ask about a lot of different things, about ICE, about all, everything that's happening.
Yeah.
Is the impulse to remove funding, to remove resources, to remove this kind of infrastructure, was this based on just blind ignorance, or was there something more, a sort of broader motivation here? Is this a privatization move, or is this a libertarian move? What are we seeing?
Yeah, I mean, I certainly think underlying it is ignorance, right? Ignorance of the fact that a division of parasitic diseases and malaria would be helpful, right? Inevitably, there will be a need for this group of experts to exist within the agency, within CDC. And then, being like, we shouldn't be surprised when a parasitic disease causes an outbreak that is like blown up, no pun intended, but blown up the way Cyclospora has. We should not be surprised that eliminating that department would make it even worse. So I think the base level of ignorance in RFK Jr., in the political appointees, I think we've all seen reporting that, emails were going around telling then CDC Director Menares at the time, before she was fired, that you got to clear everything through the political folks, right? And that's a real problem, right? Politics and public health definitely interact and intersect, and was put in stark relief during COVID, but continues to this day. I mean, he was nominated, or he was confirmed on a political basis, right? 50 votes, 50 Republican votes. Famously, Senator Bill Cassidy, who was assured, that things would go okay, and like, wow, shocker, that's not happening. So it's inherently political, but like the decisions made at where the healthcare is happening, where the public health is happening, they can't be political. They just have to be based in reality, based in science. And these guys just can't seem to understand that, and it's showing up. We're seeing the consequences.
So we also have measles, right?
Yeah.
The measles outbreak, by some measures, was eliminated, in 2000. Who thought we would be dealing with this right now? How bad does this get from here?
Well, I mean, it could get very bad. On the positive side, your county health department, wherever you live, is staffed with dedicated individuals who just want to serve their community, right? You don't go into public health at the county level to get famous or to get rich. Like, it's literally, I want to protect my community. And so we have, fortunately in public health, we have multiple layers, right? We call it medicine the Swiss cheese defense, right? If a little hole gets through here, well, gets picked up somewhere else. So you have city, county, state. We're seeing Legionella, a Legionnaires outbreak in the Upper East Side, New York City. And I know their health commissioner, Dr. Alistair Martin's doing a great job there in their state health department. But there is a gaping hole at the very top, right? The vacuum of leadership. I believe 11 out of 22 departments within CDC do not have a director, right? It is a real problem. And I think we can expect that outbreaks like this of varying pathogens are going to be worse than they could have been had we had good people at the top who had good intentions and were simply doing this job without the fanfare, without the glory, just for the sake of helping protect people.